Hello and welcome. Thank you for joining. My name is Jessica Mulcahy. I'm a health educator for community health at Atlantic Health System. Tonight's webinar, Changes for a Healthy Heart, is presented by Dr. Robert Fishberg. Before we begin, I have a few announcements. This webinar is being recorded and will be shared in its entirety on our website. All participants are muted. If you have a question, please use the Q&A for questions or chat for comments. We will try to get through all questions at the end of the presentation. At Atlantic Health System, we care and provide a variety of mental health services at various locations. Our team features highly trained psychiatrists, psychologists, social workers, and licensed clinicians. Learn more about our behavioral health services by visiting atlantichealth.org/behavioral info or schedule an appointment for a behavioral health service by calling 1-888-247-1400. And with that, I will turn it over to you, Doctor.
Thank you. Let me see if I can share my screen now. Let's see if this works. I press this and do you see my screen now?
Not quite.
Let me go back to this again. So if I press this and I put on share screen, I press that, okay? And now,
All right. Perfect.
okay, so my name is Robert Fishberg. I'm a cardiologist at Associates in Cardiovascular Disease, which is part of Atlantic Medical Group. And we're talking today about changes for a healthy heart. Just some background for myself. I was in practice since 1989. I actually was a resident at Overlook Hospital, so I've been in the area of 40 years. And I work in a large group. I'm based mostly in Springfield, but also in Clark, New Jersey. I work at Overlook and Morristown Medical Centers. And I started my work initially as a interventional cardiologist, but I've really become more of a preventive cardiologist. So that's what we're going to talk tonight, how we could, how you could have a healthy heart, how you could keep a healthy heart, and just some tips about that. And I'll be using a number of slides for the American Heart Association, but sprinkled with some other slides too. So healthy living, how making small changes can lead to big impact in overall health. And that's what we're talking about. It's a lot of times it's small changes that you can make that can make a big change, in your life. And again, a lot of times you're doing a lot of things right. You just have to make sure you look it over and try to do even better. Why is this important? Let me advance my slide. Why does it matter? For the first time in decades, we see deaths from heart disease and stroke on the rise. Now, when we look at heart disease, this is an insidious process. It's atherosclerosis, and actually often starts even from the first decade, second decade of life. You have progression atheroma. So this is a hidden disease, atherosclerosis, and it progresses often from when you're even teens and into your 30s, 40s, and 50s. That's when you have the biggest risk for a heart attack. And again, this is what the streaks look like: a fatty streak, fibrous plaque, and a complicated plaque. So these are all things that we all have to be aware of what develops. Again, a lot of times people say, well, I feel so good. How can I be having a heart attack? Well, again, it comes on slowly, but again, when it happens, you have a heart attack, that could happen suddenly. But when we look at what happens with heart disease, we have seen an improvement from over the last 30 years. And, in my time as a cardiologist, I've seen great improvements. We've seen improvements in the coronary care unit. We've had thrombolytic therapy. We have had improvements with stents, angioplasty stents, new medications, statins, all make a big difference. But what's happened is as we've gotten older, may become more sedentary. We've also had a epidemic of obesity and also diabetes, and that's why these curves, rather than continue to go down, they've kind of flattened out. So this is what we have to work on, and we have to try to see if we could keep improving. And there is hope, and that heart disease can be prevented. And even if you had a heart attack, even if you had a stroke, you could do things to prevent you from having further problems. So we want to live healthy for ourselves, for our family, for the communities. Again, it's not just about us, it's about the families that we impact, about the community we live in. So again, we have to, and again, eating, this is even more important in a time of COVID, that we have to think, but what are we doing? What could we do better? And the American Heart Association breaks it down into life simple 7. These are all very intuitive, but again, if you do all these things, you will be healthier. So again, stop smoking, eat better, get active, lose weight, manage your blood pressure, control cholesterol, and reduce blood sugar. Now that sounds like a lot, and say, oh my God, how can I do all those things? Well, again, small steps along the way, you could do it. So looking at, again, this is a guidelines for American Heart Association and also from the American College of Cardiology. One important things is they've actually specified what we should be eating. And that was always a big thing with a diet. What should we be eating? What's the diet? Should I be in a vegan diet? Should I be on a low carb diet, intermittent fasting? But every diet you're on, this is what you should be doing. You should emphasize a diet that's that emphasizes vegetables, fruits, nuts, whole grains, lean vegetables, animal protein, and fish, and minimize the intake of trans fats, red meat, processed red meat, refined carbohydrates, sweetened beverages. What does that mean? That means when you eat, you have to be really careful how you shop, how you eat. You want to have, when you look at vegetables, you want colorful vegetables all around the plates. You know, reds, yellows, greens. The more color, the better. That way you may have more phytonutrients. So, you know, vegetables, fruits, nuts, whole grains. We usually recommend a Mediterranean diet, which is what this is kind of emphasizes. Olive oil. You know, don't use solid fats. And again, when you have meat, again, you want to have a healthy diet. And this is what we do. I actually, my wife does this very well. We roast vegetables, and we don't grill fruits, but like even kale. Kale is very bitter to eat sometimes, but when you roast it or put in the oven, it actually becomes better. So roasting vegetables is a great way of doing it. But again, as many vegetables as possible. Again, the different colors you want to have: orange, yellow, green, all different colors is good. And it's the vegetable which is the main course. The meat is really more the appetizer. You should think about that. So eat more fruits and vegetables, whole grains, low fat dairy products, skinless poultry or vegetables, nuts, legumes. Again, you don't have tropical vegetable oils, and also you want to have lean meats. And eat less saturated fat, trans fat, sodium, fatty red meat, sweets, and sugary drinks. Now, you should really switch your diet from having saturated fats to mono or unsaturated fats. That's a transition we should be making. And fish is great. As much fish as possible is good. And stay away from sugary drinks. Stay away from soda. Have more water. Seltzer is better. Stay away from sweets. When you shop, you should be shopping on the perimeter of the supermarkets. Don't have the processed food in the middle. Stay away from, and again, be careful with salts. You want to limit your salt, particularly if you have high blood pressure. So when you buy canned vegetables, You want to stay away from things with salt. If you do buy canned vegetables, make sure you wash the salt out of them. So cook more at home, plan ahead at restaurants. Again, as I just discussed, grocery shop wisely, and be aware of serving sizes. So really, when you think about a serving of meat, a 12-ounce piece of meat is really 4 servings. So you really want to think about that, having a small, if you do have meat, have a small portion of meat and mix it up. If you have red meat, have a small portion of red meat. Same with chicken or pork. Think about having tofu. Think about having a meal without meat, just with vegetables, with legumes. Beans have it based on beans. Now, exercise. Now, we talked about eating healthy. We do besides eating, you want to exercise, maintain a healthy weight. This is really important. So you want to exercise, break your day. You can break up in multiple workouts. It doesn't have to be 30 minutes at a time. So this is what the American Heart Association and the American College of Cardiology recommends as a class 1. That means everyone should be doing it. And this is what they tell doctors to do. That I talk to every patient when I see about their diet and exercise. No one leaves my office without a discussion about that. Even as a cardiologist, I feel this is the most important thing you could do. And also the amount of exercise, approximately 150 minutes a week, which breaks down to 20, 30 minutes a day, maybe less if you do a vigorous intensity activity, but think about exercise every day, 20, 30 minutes. Again, that could be broken up into 2 sessions. So just think about that. Now, if you smoke, it's simple, stop smoking. Now, again, this is difficult. It's easy for me to say being a non-smoker, but you need to do everything you can to stop smoking. It affects your blood pressure. And if you do stop smoking, even if you think there's some damage to your vessels or to your lungs, your body does start to repair itself. Now, there's aids to stop smoking, and that's something I'm sure that Atlantic Health could help us with programs for smoke stoppers. There's methods like acupuncture that work. There's behavioral ways that work. There are also medications, and there's all different things. But again, if you do smoke, this is where you can reach out to Atlantic Health for methods to stop smoking. And again, you want to manage your blood pressure, cholesterol, and blood sugar. And again, important thing is the oils you cook with does help. Using olive oil versus saturated fat is important. And you want to raise your good cholesterol and lower your bad cholesterol. Now, when it comes to your blood pressure, it's fairly simple. You want your blood pressure preferably less than 130/80. And this is regardless of how old you are. There's an old myth: if you're older, you could get along with higher blood pressure. That's not correct. Everyone should have blood pressure less than 130/80, no matter what your age is. Even more important for diabetics or if you have a heart or kidney problems, the lower the blood pressure, the better. Then a problem is sometimes there's medications that you have side effects, and that's something that as a cardiologist and as you working with your primary care physician, they can help you with that. But again, it's important to have controlled blood pressure. All these things help prevent the heart. Now, when it comes to, again, diabetes, you want your A1C definitely less than 7, but closer to less than 6 if you can, and blood sugar control. Now, cholesterol, which is really my major interest, is we do have epidemics of hypercholesterolemia in this country, that there's so many patients with cholesterol over 200, and you do want to break that down off into good and bad cholesterol. You want your good cholesterol preferably over 50, over 60. You want your bad cholesterol preferably less than 100. And again, 1 in 3 Americans have high LDL, which is bad cholesterol. And this is something they should get checked. So I do believe that, as you know, it's one thing for pressure, your cholesterol, your blood sugar, but you need to take responsibility yourself. You should know what your numbers are. You should know what your blood pressure is. Take your blood pressure home if you can. Know your blood sugar, and also know what your cholesterol is, and the breakdown of the good and bad cholesterol. So there is a program with the American Heart Association, Check, Change, and Control Cholesterol, that tries to increase awareness. And one of the programs we work with is working with the American Heart Association, working with other groups to improve the awareness. Now, this slide is from the American College of Cardiology, American Heart Association. If you do have heart disease, or if you do have atherosclerosis, we need to get your cholesterol down, and you need to take a statin. Statins are drugs I'm sure most of you are aware of, like atorvastatin or Lipitor or rosuvastatin or Crestor. These are drugs which could lower your cholesterol, and we believe this is very important to treat you if you do have atherosclerotic disease. And we do want to get your LDL less than 70. In some people, I want to get the LDL less than 55 if they're at really high risk. And there's medication we can add. If it's not enough with the statin, we use medication called ezetimibe. And then there's new medication, which are injectable, which are called PCSK9 inhibitors, which can lower it further. And again, if you want to know what the best cholesterol is, if you do have heart disease, lower is better. And I have patients who have LDLs less than 30, and I'm happy with that, because again, the lower the cholesterol, the lower the risk. Now, this is a test that some of you may have had done, may have heard. It's called a calcium score. It's a very simple test. It's a CAT scan of the chest. And if you do have evidence for calcium in the coronaries, like this patient has, then you do have atherosclerosis, and you could be at risk for having a blockage. This doesn't actually show the blockage, just shows calcium in the coronaries, but this patient should not have this, and this patient needs to be assessed and probably needs to be treated with a high dose statin. So that's an example of a test patients often have, who want to know, should they be on a statin? My cholesterol is 100, my LDL is 130. Do I really need a statin right now? If that patient, who's say 55 years old, has an LDL 130 and they have calcium, yes, they need to be on a statin. This patient here is 71, active, mildly elevated, and has severe calcification. This patient could be at risk for a heart attack unless it was addressed. This patient probably would need aspirin and a statin, and to be assessed to see if there's a blockage. Could have, this doesn't show there's a blockage, but it's a suspicion of a blockage in the left anterior descending. How about stress? I hope my talk's not giving you more stress. If it is, I apologize. But stress is very important. And again, when I see someone in the office, particularly in my office in Springfield, stress is always a component. And I think we live in a very stressful society. This may also have been worsened by COVID with the sense of isolation and the frustrations with our family members, and maybe people that we've lost who are sick. And I think as we get older, we accumulate more stress. So this is something you have to recognize. Again, this is something that we can help you at Atlantic Health with a behavioral department. We could get a referral if you need a counselor for stress. We have that available. And again, this is an epidemic in our society. And maybe this is one of the reasons why the curves have flattened out, is, not only are we overweight, we're not eating right, we have a lot of stress, we're not sleeping well, and we're not addressing it. Sleep is very important. You need to get your 7 hours of sleep. Don't watch the news at night, particularly what's going on now with the world. If you're going to watch anything at night, make sure it's something which is humorous. And again, make sure you do what you can to fall asleep. Don't have the TV on night trying to fall asleep. Make sure the lights are off, and try to get this at least 7 hours of sleep a night. And if you think you're under stress, have that addressed by your physician. There's behavioral treatment, there's medications, but again, stress is a stimulant for heart disease. Consider meditation. We actually offer meditation at Atlantic Health too, and meditation is an excellent way to deal with anxiety, depression, lower stress. All these things work together. Keeping yourself healthy is not one thing or the other, it's all these things working together. So meditation, stress reduction, yoga, these are all things that can help. Being in groups help. Being isolated in COVID is not a good thing. So being with people, being with your family, being with loved ones, listening to music, all these things help to decrease anxiety, depression, and stress. All these things increase the risk for heart disease. If you have a dog, dogs are a great stress reliever. Or a cat, maybe. I don't want to say dogs are better than cats. So these are things to keep you well. Getting enough rest makes you less likely to crave sugary, fatty foods. You don't need to turn yourself into a pretzel to meditate. Find a position that's comfortable for you. Exercise will only improve your physical health, but also give you a boost in mood. Don't overlook your emotional and mental stress. Get help if you need to manage stress, anxiety, depression, grief. Everything works together. So we want to live healthy for ourselves, for our family, for our communities. And this is a nice little slide about just all the things we're talking about here. All these things help to reduce atherosclerotic risk. Weight loss, weight maintenance, avoid diabetes, control lipids, control hypertension, eat more polyunsaturated fats, dietary omega-3, which is, again, fish, dietary fiber, and phytonutrients. Phytonutrients, again, all those green things you see. And also think about fruits. Blueberries is a great source. So eat more blueberries, eat more fruit. Those are a great source of phytonutrients. Avocado, there's a recent article about avocado being a great for heart. So all these things are good. Again, all different colors, and all these things are good for the heart. Eat less saturated fat, trans fat, cut back on dietary cholesterol. You don't have to have 3 eggs every morning. Cut back on cholesterol. Decrease sodium. We have much more sodium in our diet. Be aware of foods that have hidden sodium. When you go out to dinner, be careful about sodium. Cut back in calories. Again, it's hard to know the best way of losing weight. Some people do intermittent fasting, but again, cutting back calories is the most important thing, and cut out refined carbohydrates. Again, you want to be careful with cakes, cookies, prepared things like that. If you want to have desserts, keep your desserts natural. Let me go on to the next slide. So check, change, and control cholesterol. Physicians at Atlanta Medical Group, we've teamed up with American Heart Association for check, change, control program. Again, I work with a team at Atlantic, and we have a website called Controlling Cholesterol. So feel free to go on the site, atlanticmedicalgroup.org, Controlling Cholesterol. And a lot of things we talked about will be on the website that we developed. And there's resource links on it. There's some videos, and we have resources for patients and for professionals. Again, it's working with not just the American Heart Association, working with anyone that can help us with this. Now, this is a very busy slide. This is something which I'm personally very interested in. This is what my research is in. So I just want to share what my personal interest in is. Even though I'm a clinical cardiologist, I do a lot of clinical research at Atlantic. And one thing which I'm very interested in is a hidden risk factor called lipoprotein A. Again, this slide is there's much too much in the slides. I want to show you how complex this is. This is a risk factor was associated with atherosclerosis, inflammation, thrombosis, calcification. It could lead to a heart attack or a stroke or aortic stenosis. And again, it's a hidden risk factor. It occurs in about 20% of people, but even at some level, but at a very high level, it increases the risk. And uh, there are many people who have elevated LPA, and if the people that we think most likely could have this as a hidden risk factor is if you have a strong family history of heart disease, your cholesterol's high, or if some reason at an early age, under the age of 60, you did have a cardiac event, or a stroke, or peripheral vascular events. These are people who could have this as a hidden risk factor. And again, at, um, at Atlantic Health, we're one of the leaders in research with this, and we do have a couple of ongoing clinical trials looking at this. And we think in the future, this may turn out to be maybe it's a very important risk factor now, and we're developing medications that can actually treat this. So just keep this in the back burner. But if anyone has a strong family history of heart disease, or have atherosclerosis at early age, it's worth having this checked by your doctor. It goes called lipoprotein A. That's the test. And I want to thank you for listening to my presentation. And this is my family, my birthday, my 3 granddaughters, and my lovely wife. So thank you very much for listening. So.
Oh, thank you very much. And for those of you who may have joined after we got started, you are muted, so please enter your questions into the Q&A so that we can respond to them. I do know that I had gotten a question earlier before the program even began, and actually it was about that LPA, and wondering about specifically how do we test, how would someone, is the trial open to anyone? Like how would someone get referred into that?
Well, the present trial that we have is actually we finished enrollment. But if you are interested, we are working on other future trials. So if you think you are at risk for that, you could email me if you're interested at robert.fishberg@atlantichealth.org, and we could see if you're eligible for a future trial. But again, that's something which is it's something which I'm personally very invested in. Let me see this. Are there other things in the chat? Can I see the chat? Let's see.
That may have been me reminding everyone to enter their questions in. We haven't gotten any additional questions yet. But I do know from just a personal standpoint, if a patient has high cholesterol, how long will it typically take for someone to lower that cholesterol through diet or exercise? And if that's not successful, when do you begin to possibly introduce the prospect of statins or other medications?
So am I still on video? Do you see me still? I can't see myself anymore.
I do see you, but it looks like your video is frozen.
Oh, okay. Let me see if I could. Let's see if I could restart it. Okay, let's see.
I was going to say, sometimes turning it off and turning it back on.
Oh, there we go. Perfect.
There we go.
Okay, good. So the question is, if your cholesterol's high, when do you start a statin? Mm-hmm. So again, the first thing is exercise and diet, but again, it has to do with the risk assessment. So it has to do with your age and how high the cholesterol is. And that's why a test like a calcium score is really important, because if we do a calcium score, again, all it is a simple CAT scan of the chest, and we see evidence for cholesterol buildup of calcium. That means you need to be done more urgently. If there's no calcium buildup, then we may not do it. And we actually have a risk calculator. So there's a calculator. I could have shown the calculator. There's a calculator that we use based on your age, sex, the cholesterol level, and blood pressure that will give us a risk calculator. And if the risk is over 7.5, per for 10 years, percentile for 10 years, then we recommend a statin. But things affect that risk. For instance, a strong family history may have convince us to put you on a statin. If you have a calcium score is elevated, but if a calcium score is 0, that may persuade us not to use a statin. Again, exercise and diet is always done with that. And there's some other risk factors too. If you have other diseases, if there's a kidney problem, obviously if you're diabetic, every diabetic should be on a statin. If you have a rheumatological disorder, if you're South Asian, just being South Asian itself puts you at higher risk. So there's a lot of factors we look at. So again, exercise and diet, but the timing of a statin depends on your risk assessment and risk enhancing factors that we use to assess that.
Excellent. And
So,
there is a question that came in through the chat. What is your opinion about COVID affecting the heart?
well, I'm worried about that because there is an incidence of myocarditis with that. So, I've seen, so it affects it a few different ways. I've seen people that we've had a few incidents of myocarditis, which is a inflammatory condition where the heart becomes suddenly weak. I haven't, we had some in the hospital. I haven't personally seen that. So that's one thing I'm worried about. So sometimes in those situations, I may do an ultrasound of the heart to make sure there isn't a weakness of the heart muscle.
Mm-hmm.
I'm also concerned with long COVID, with people who would develop dizziness, palpitations, and a syndrome called POTS, which is a positional orthostatic tachycardia, which is very difficult to treat. So those are things we worry about with it. I'm also worried with COVID with thrombosis. You could have an increased risk for venous thrombosis, blood clots in the legs, which potentially could be life-threatening. So those are things I'm worried about with COVID. A good reason to get the vaccine to avoid getting COVID and to get the booster. Again, you might say, well, I'm afraid I could have a problem with the booster, but again, the evidence is that the booster and the vaccine will prevent you from being sick with COVID and may prevent the acute problems and the prolonged problems we see after COVID.
Mm-hmm. And our next question is, can you elaborate more about the calcium score and what the thresholds of the, what are the thresholds of the score?
Well, that's a very good question. So again, the most important aspect of a calcium score is if it's 0, that's a great predictor. If you have a 0 calcium score, then you may not need to go on a statin right away. It's somewhat dependent on age. As you get older, it becomes more calcified. So we do grade the calcium score by age. So if you have, for instance, if you're older and your calcium score is 100, it may not be, that's better than if you're young with a very high calcium score. So, 0 is the best. Over 100 is significant. But again, it's also graded by age, and we have a scale depending on how old you are about what the optimal level. And again, we look at percentile. If you're over the 75th percentile, that's for your age and sex. That's higher risk. We treat that aggressively. But I usually treat people aggressively over the 50th percentile. And if there's a question whether someone should be in a statin or not, any degree of calcification, particularly in a younger person. So for a woman, a calcium score is very good because if you're under the age of 60, you have any degree of calcification, that's significant for a woman. So it's a very good test for anyone, but it's probably when I see someone, the calcium score is probably the most important test that I do besides my exam and the blood test. If you have symptoms, then a stress test is very helpful too.
Mm-hmm. And for the calcium score, it sounds like sometimes it can be a great indicator. Do you recommend people getting one like younger so that they can have like a baseline to compare to future calcium scores?
So again, it is radiation, so we want to be careful with it. We only recommend it probably every 5 years at most. And under the age of 35, it may not be that helpful because it takes a while to develop. So you may have atherosclerosis, soft plaque, and not show up in a calcium score. So it's really best over the age of 35. But again, if you have very strong family history, if you have elevated LPA or the risk factors, I may do it under the age of 35 in those situations. But again, um, I wouldn't do it routinely for everyone, but if someone has risk factors, they have elevated LDL, that's why I would do a strong family history. That's why I would do it on. And I also find, again, LPA for me, is very useful because if you have elevated LPA, that's someone who's at higher risk. There's a recent study that if you have both elevated LPA and a high calcium score, you have very, very high risk. So it's
Interesting.
two good things to order for your doctor to consider.
Okay. Um, and the next question is, how is the calcium score actually calculated? What values are used to determine the number?
So it's actually fairly simple. Like the picture that I showed before, where you saw the white part that's why I want to show the picture. You just kind of measure how much, you look at the arteries, how much calcification you see. There's a measurement for it. The more calcium you see, the wider it is, the denser it is, the higher the score. So I actually look at whenever someone has a CAT scan, even if a CAT scan isn't ordered specifically, I look at every CAT scan I ordered to see if I see calcium in the coronaries, because that's someone that has atherosclerosis. So it has to do with the amount of how much how much calcium along the arteries and the density of it.
Okay, excellent. And our next question is about how long, when you have like a nuclear stress test, how often should someone have that? How long in between? Is it dependent upon risk?
So a nuclear stress test should not be routinely ordered. It's something that you should do if you can't do a regular stress. There's some people who have bundle branch blocks or pacemakers, or they can't walk, they have to have it done. But it's not something that should be done on a routine basis. Every nuclear test should be done if someone has symptoms related to it. So there's no routine nuclear stress test.
Mm-hmm.
And actually, the new guidelines for the American College of Cardiology, American Heart Association, is leaning towards a test called a coronary CT angiogram. That's a CT scan, like the calcium score, where you inject dye and you actually visualize the vessel. So it looks like most society is leaning towards that versus a nuclear stress testing. So given a choice, often that's considered a better choice. So that's the thinking's evolving with that.
Oh, excellent. And is that a shorter test? Because I do know nuclear stress tests tend to be a very long
No,
affair.
it's a similar test, but it's also non-invasive. Everything
Okay.
has different risks. You have to use contrast dye for that. So if you have a contrast allergy, if you have kidney problems, that may not be the best test. If you're older and you think there's a lot of coronary calcification, that may not be a good test. But for a younger person, um, it often is a better test to actually visualize the blockages in the coronaries. Again, not all the blockages are the calcified blockages. You also have soft plaque that will reveal. So you can see, when you see a calcium score, you may have a very high level. But I've had patients, athletes with very high calcium scores, that when they did a coronary angiogram, there wasn't severe blockages. So it doesn't always correspond to the degree of blockages.
Okay, great. Um, and I think the next question is the LPA test that you've mentioned. Is it like a blood test? What kind of test is
LPA is a blood test. It's a relatively inexpensive blood test. It's not on a normal blood panel,
it?
but again, it's a hidden risk factor, and you could get it through Atlantic Health, or you get it through our lab, LabCorp Quest. And it generally doesn't. It's usually covered with the right diagnosis, high cholesterol, family history, and even out of pocket, it shouldn't be more than $25. So it's a really relatively inexpensive test, but it will tell us if it will help determine if you're at risk. And again, in the study that we were involved with are people, a new medication that lowers it down 80%, because no drugs The reason doctors haven't checked in the past, because there was nothing to treat. Now we have a new medication that would get treated, and we're just trying to evaluate how effective it is. And that's what we're studying. So it's a breakthrough medication that treats it, and it reduces LPA up to 80%. And we actually have 30 patients in the study. We're one of the largest sites in the country. And these are patients who had unexplained heart attacks or unexplained strokes, and we found that they had very high lipoprotein A.
Oh, wow.
So I hope that, I think this will be a successful trial. One thing about trials, you don't know when it's randomized, you don't know until it's completed, but everything points that this will be a landmark study.
Very interesting. And our next question is it common to have blood pressure readings at home that are 10% less than at your physician's office? This person notices that they have a variation of.
But let me put it's got dark over, so I'll only put the light on here. Sorry. Okay, that's a little better now. I was in the dark there for a while. Sorry. I used to have really red hair. Sorry about that. I used to have red hair. That things do change. So yes, so the blood pressure at home is often lower. So some people have very high blood pressure in the doctor's office. And if you have a good blood pressure monitor, one that goes around the arm, the biceps, that's usually very accurate. And I would take your blood pressure before you see a doctor. If you can, bring in your blood pressures. Take it when you do it, make sure you're sitting down, make sure you're resting, and take your blood pressure 3 times and kind of average it out. Sometimes the first one's not accurate. So it's very common that the blood pressure in the office is different. And again, I want to be careful not to overtreat patients. So the more data you give us, the better.
All right. And the next question is hearing your heartbeat in your ears an indication of anything seriously wrong with your cardiac system?
No, that doesn't really. People have different. That shouldn't be. That's not indicative of anything. Some people are very sensitive to their heartbeats, but that it shouldn't be. Obviously, if for some reason the heart's going fast, you get lightheaded, but just. It's unusual to hear your heartbeat. That's an unusual thing. You must have very good hearing, but usually you can hear your heartbeat. But that's not. It shouldn't be an indication of anything.
Okay, great. All right. A lot of good questions that came in so far. Just waiting to see. We don't have any more in the chat or the Q&A. And if anyone would like some of the additional resources, I will send an email with some of the resources that were mentioned on our page, as well as I know it was mentioned our Quit Smoking resource.
Yes, Jessica, we finished now? You were frozen for a while. And now you're muted, I think.
Got kicked out. I apologize. I was just wrapping up saying that I would share resources, and also that will include, I know it was mentioned, the smoking cessation program. We do have one of those at each of our medical centers. They have been virtual, but I do know that I think they are moving back to in-person groups, and you will get free nicotine replacement therapy as part of that program if you enroll in it.
What's the link for the behavior group? Is there a link for that too?
Yes, atlantichealth.org/behavior-info, I believe it was.
Okay.
I can include that link in the email as well.
And also, you could include my link for controlling cholesterol and Atlantic Medical Group. Then include
certainly.
That too. Well, it was a pleasure speaking to everyone. Again, if feel reach out if you have questions. And again, it's just I'm just impressed that you guys are here and looking to improve your own heart health. So congratulations to everyone. So yes. Thank you very much and have a great evening.
Thank you. Yes. Welcome. Thank you everyone for joining us, and thank you, Dr. Fishberg, for dedicating your time and expertise this evening. If you anyone happens to have any questions or comments, you can always email us at communityhealth@atlantichealth.org or call 1-844-472-8499. Have a great night, everyone. All
Take
right.
care. Bye-bye.
Thank you.